Okay, wait, so what do you even do during sleep therapy? Hi, my name is Dr. Jessica Meers. I am a board certified sleep psychologist and I specialize in treating sleep disorders. But most people have no clue what my job actually entails, nor do they really understand how these treatments can help them. So I figured I would try to demystify the process a little bit by walking you through what the treatments for insomnia in particular actually look like. Okay, so here's what actually happens in the first sessions of CBT-I. So first, I will always schedule a free 15-minute consultation call with anyone who's interested in pursuing treatment. This allows us to take some time for me to ask you a few details, make sure that I'm a good fit for you. I'll provide you a quick overview of what happens during therapy, answer any questions you have, and we'll talk about expectations for how and when we'll meet, whether it'll be virtual or in person, how many sessions we'll have. Generally for CBT-I, which is the treatment that I use for insomnia, we'll meet 4 to 8 sessions on average. Sometimes more, sometimes less. Each session is going to be 50 minutes long, 50, so almost the full hour. Okay, so once that call is done, we'll get the first session scheduled, and we'll sit down during that first session. And this first session is what us psychologists call an intake session. And this is an opportunity for us to sit down, get to know each other, and also go over some paperwork like consent forms, practice policies, kind of housekeeping stuff. And then after that, I'll get into some pretty detailed questions about you, your sleep in particular, but also your medical history, your psychiatric history, and your general health. And we do this because it's so important for us to rule out other potential issues that could be impacting your sleep and make treatment either ineffective or not as effective as it could be. So for instance, like sleep apnea, if you have breathing interruptions during your sleep, our treatment is not going to be as effective as we would like it to be. Then we'll spend some time together setting goals. And I'll get you started tracking your sleep with a sleep diary, so logging how you slept each night. And usually I have people do this within an app. It takes just a couple minutes every morning, and that lets me see their data in real time, and you can even ask me questions within that app, and it's free for people to use. This is what that first session looks like, and I know it could be sometimes disappointing that we don't jump in right away. But I want to emphasize how important it is that we get the full picture of what's going on so that we have the right diagnosis, so that we know we're treating the right problem. It also lets me have time to collect that about a week's worth of sleep diary data so I can really see what we're going to be working with. I'll pause here to say, though, that everyone is different and everyone has unique needs. So while this is a general summary of what tends to happen, it's not going to flow this way for everyone and not in the same exact pattern. So for instance, we'd probably do things differently if you're taking sleep medications and you're wanting to get off of them. Or if you are a postpartum mom struggling with insomnia on top of having to get up all night for the baby. In general, for most people, this is kind of an overview of how it typically goes. So about a week after that first appointment that you had, we'll meet again. Before that appointment, usually I will have taken a look over your sleep diary data, and I'll start to be formulating some thoughts and recommendations. And when I check in with you, then we'll be able to sit down and kind of figure out what specifically is going to be working for you. During that session, I'm going to share a lot of the science of sleep and the biological and psychological patterns of sleep. A side note, this session is really information heavy. I'll admit that it's kind of a lot, but by the time you leave that session, I want you to have a really good feel for why I'm going to ask you to do the things that I'm going to ask you to do. And I want you to have a general idea of how to implement those recommendations, because if you're confused, then it's going to be really likely that you're not going to want to follow through. And so we're going to make sure that we are crystal clear on what those recommendations are. This is also where we'll see the benefits of all of those questions that I asked during that first session, because I'll usually be able to describe why you in particular developed insomnia. We'll learn the why of insomnia, and specifically the things in your life that made it more likely to happen, and how in particular we're going to fix it in your life. So my recommendations are going to be really tailored to your specific needs and your situations. So like I said, you're going to leave that session with a clear plan of action. You'll know what to do over the next week or two, and then we'll meet again in either a week or two. When we meet for that next session, we're going to check in and see what your progress has been like. We're going to see how you're doing. I'm going to look at your sleep diary. We're going to probably make some tweaks to the plan, and we'll spend some time problem solving any issues that you've encountered. So for instance, we would talk about any concerns you've been having about your sleep, any worries you've had, and we'll explore the link between stress and sleep and how that looks for you in particular. What types of thoughts come up for you, how that impacts your ability to fall asleep at night. I might send you home with an exercise or two to work on in addition to those recommendations that we've already discussed. And then we'll meet again in a week or two. Again, we'll check in on your progress, review your sleep diary, make some tweaks if we need to. And then we would pick back up on the discussion that we had around thoughts and feelings about sleep. And we'll talk about stressors in your life and how that translates to insomnia oftentimes. We might try to identify some unhelpful thinking patterns if that's going on. Like I said, everyone's different. And so in these later sessions, there's a much less predictable pattern to how it goes. We're working to identify the struggles that you in particular are noticing, and we look to find solutions. So it's going to be dependent on you, both in how you've been feeling, but also in your specific troubles. And sessions generally will proceed in that same fashion for the next several weeks. And then over time, as your sleep is improving and you are feeling better, we'll take a more future-oriented stance and start talking about ways to safeguard your sleep in the future. And then at this point, we'll either be wrapping up therapy and getting ready to say goodbye to each other, or we, as oftentimes, will switch to a different topic. So we might start working on other issues like anxiety you've been feeling, or depression, or other life stress that you want to talk about. That is what sleep therapy looks like in a nutshell. If you want to learn more, you can check out my blog this week, so the link is in my bio. Reach out to me if you have any questions or you want to chat about your sleep. I'm here to help.